That being said, I think there's been quite a few questions about whether frontline workers should delay their medications or stop their medications if they're not symptomatic. And I think the answer that we've repeatedly given is please don't, please continue. Even delaying 2 weeks at this point, we're not at this is going to last a long time. So delaying 2 weeks is not going to be particularly helpful and may actually hurt if we get to that peak that Gil talked about earlier, where if you flare up and the hospitals are overwhelmed, you're going to be in trouble.
Yeah, absolutely.
So do not delay your medications, even if you're frontline staff, even if you're a healthcare worker, even if you're working in a grocery store, please, please.
And I think just to add on to that for one moment, at least in the healthcare worker setting, people do have protective gear and appropriate PPE in place. And coming back from the fear zone to the biology zone for a moment, we know how this virus transmits. We know how we can prevent it from transmitting. Most powerful, physical distancing, but the PPE works pretty darn well when we use it appropriately in frontline workers. And so I think that reminder in the back of our head about how does this transmit? What else am I doing? If I can't do the physical distance, what am I doing? And there's a lot of things that people can do, especially for healthcare workers, that they will be doing to kind of mitigate a little bit of that fear.